Hello, everyone. So, we're celebrating mothers this month as Mother's Day is observed in May in the US. And in honor of mothers, I'm going to be shedding light on a topic that is sometimes overlooked, and that's perimenopause and menopause. This is part one of Connecting the Dots. It's going to be a four-part series, and we're going to talk about all things perimenopause and menopause, what it is, what's happening in your body, and how to feel better through it. So, menopause is a natural transition, it's not a disease. And the truth is, as women, we're fortunate enough to live long enough if we go through it, right? So, that happens towards the end of, towards the middle of a lot of women's lives. So it's not something to be afraid of. It's actually something that we should honor, but it's something often confusing and misunderstood for many women. So I hope to help people through the series understand it a little bit better and understand that they don't have to suffer through it any longer. I'm Dr. Lola Ashaye. I'm a board-certified family and lifestyle medicine physician and owner of InTouch Primary Care in Sugarland, Texas. And you're listening to Connecting the Dots with Dr. Ashaye. So if you or your loved ones have been putting off your care due to healthcare frustrations, or you're seeking a more personalized approach to your health, I invite you to learn about our membership program. We are dedicated to making high quality healthcare accessible and stress-free. So let's dive in. But don't forget to subscribe. Don't forget to share this with a friend and book a visit today if you want to start your health transformation. Okay, we're going to start with what is menopause. And menopause is simply defined as the moment you've gone 12 full months without a period. So it typically happens around age 51, but it can range from 45 to 55 in terms of when it happens. Menopause is really just that one day that it happens when it's been exactly 12 months since you've had a period. However, everything leading up to that moment is called perimenopause. And then everything after that moment is called postmenopause. So you have menopause, perimenopause that's leading up to menopause, postmenopause, after menopause, okay? So menopause isn't a failure of the body. It's not something to be, afraid of. It's a transition. It's signaling that your ovaries are going into retirement, but you are just getting started with a new season of your life. So it's an exciting time. So I spoke about perimenopause before. So perimenopause is that time before menopause that many women go through where the hormone levels start to change, start to fluctuate. The hormones affected during this period are estrogen and progesterone, especially. And these hormones start to fluctuate a lot during this period, this perimenopausal period. It can start in your late 30s or 40s, and it can last several years. For some women, even up to 10 years. So there's a long period where the ovaries are kind of, slowing down and trying to make up their mind about what they're going to do before you actually go into menopause. So during this time, people can experience symptoms. The periods may become irregular. Sometimes they get heavier. Sometimes they get lighter. Sometimes they are more frequent. Sometimes they're more apart. Some people feel more tired, moody, anxious. Some have sleep problems. Some start to experience hot flashes. So this is not aging, okay? This is hormones, hormone fluctuations when this happens. Okay, so hormones, let's talk about hormones. What are hormones? Hormones are chemical messengers. They are messengers that tell the body what to do, when to do it, and how much of it to do. Okay, so they're little messengers. And we are very familiar with many hormones. For instance, melatonin is a hormone, okay? Thyroid, we have levothyroxine, which is often used to treat thyroid condition, hypothyroid. It's a hormone. Insulin, used to treat diabetes, is a hormone. Cortisol. So we know about hormones. We hear hormones all the time, but hormones are just messengers, little messengers in the body telling your body what to do, when to do, and how much of it to do. Okay. And the hormones we think about when we think about reproduction are estrogen, progesterone, testosterone, but we need to know that these hormones do many more important things beyond just reproduction. And that's why when they start to fluctuate, people not only have reproductive type symptoms, they have other symptoms because these hormones are important in other processes in the body. So we know estrogen, progesterone, testosterone are reproductive hormones as well, but they do so much more than just support fertility. And that's really important. So let's break it down a little bit more so that it's a little bit more clear, okay? So what do estrogen and progesterone actually do? And we can use the menstrual cycle, for instance. So in the first half of the cycle, we know that the estrogen starts to increase. The estrogen is building the lining of the uterus, but many people also experience a boost in their mood, in their energy, because estrogen can make you feel good. And so in the mid-cycle, a lot of women will have a boost in their mood and energy. Well, after ovulation, that's when the egg is released from the ovaries, progesterone, which is the other hormone, will kick in. And that hormone actually can calm the brain. It also prepares the uterus in case of pregnancy. And that's why progesterone can help with sleep and anxiety because it gives a calm feeling. That's part of it works in the brain as well. But when there's no pregnancy, so when the egg is not fertilized, both the estrogen and the progesterone drops. And then people have their periods. And then there are some women that notice that drop because when it happens, they start to have symptoms because of the drop in hormones. So when these hormones start to fluctuate in perimenopause, you can imagine when they go up one day, down the other day, they can also cause symptoms. And that's why some people experience mood disorders, brain fog, their sleep is affected, their energy is affected, and many more things. Okay, so I hope by now we know that estrogen, progesterone, and testosterone are not only useful for reproduction, right? These hormones are involved in other parts of body function. We've talked about brain function. They're also important in bone density, heart health, and we're going to talk about that over time, mood regulation. Estrogen does help with vaginal health, but it also supports our memory. It keeps our skin, our bones strong. Progesterone helps in uterine health, but it also helps to calm sleep, keep us calm, helps with sleep, helps with emotional balance as well. And many men can testify about testosterone. Women have testosterone too, but many men that have low testosterone notice a huge difference when they get testosterone replacement, and women can get that too. Increase in energy, libido, muscle strength. So all of these hormones do more than just help reproductive health. So when women feel drop in their hormone levels and they have symptoms from it, it's important that they understand what is happening. So remember, and this is the other thing, another myth that we should talk about, that hormones only matter when you're trying to get pregnant. So it's important to understand that hormones are active your whole life. They're messengers, as I mentioned, that influence your brain, your heart, your bone. Your reproduction is just one of their primary function, is not the whole thing. And so when they're affected, it's important to understand that it's not just the reproductive part that is affected. There's so much more that can be affected by them. So I hope this helps clarify a little bit more about understanding hormones, understanding what's happening in the menopausal stage, understanding why it causes symptoms in some people. And in part 2, we're going to go deeper into what happens to your hormones during perimenopause and menopause and why symptoms can feel so intense, even when your blood work looks normal. So if this was helpful, please go ahead and hit the like button, subscribe, share with a friend, and help the women out there know if they are struggling with symptoms right now that it's just a powerful transition. Nothing is wrong with them, and we will learn more about how we can, and they can learn more about how it could be helpful, how they can be helped. All right, so I hope this has helped, and I will see you next week with part 2.